Hi, my name is Alexis Kelly. I'm a student nurse here at FSCJ. I'm currently in the ADN program. I'm going to be demonstrating an NG tube insertion as well as irrigation today. I'd have my doctor's orders. I'm going to verify the type of NG tube as well as the reason for the placement of the NG tube. I gather all of my supplies, my gloves, my towel, a small cup of water for the patient, a small basin, 60 cc syringe, my NG tube, lubricating jelly, tape, as well as my rubber band. I would knock on the patient's door, introduce myself, identify the patient using two forms of identification, their name and birth date. I'm going to verify that with their armband and have them repeat it back to me. I'm going to perform hand hygiene. I'm going to place the towel over the patient's chest and place the basin in their lap. I'm going to ask them if they have any allergies or if they've ever had an NG tube placement before, and at that time I will explain the entire procedure to them. I am going to examine the nasal cavity with my pen light as well as the oral cavity. I want to look for any kind of occlusion or any kind of nasal or oral surgery that would keep me from replacing the tube. I'm going to measure the tube. I'm going to take the tip of the tube, place it at the tip of the patient's nose, around the ear, and down to the patient's xiphoid process. I'm going to leave a little bit of slack. I can take a little piece of tape and mark the placement, or I can use a Sharpie as well. I'm going to perform hand hygiene again. Make sure the patient is at a 30-degree angle at all times for the placement and after the placement, unless there's a different reason as to why they should be higher or lower. So once they're in the right placement, once they're comfortable, I'm going to open my lubricating jelly. I'm going to place it on something. I already have my tape ready, and I split one piece down the middle. Perform hand hygiene, put on my gloves. I'm going to take the 4 inches of the distal end of my tube. I'm going to lubricate it really, really well. I'm going to place it on the patient's bed. Allow the patient to have some water in just a second. Make sure there's a little bit of a bend in the tube. I'm going to let the patient know that this may be uncomfortable. We're going to start the procedure. I'm going to have them tilt their head all the way back against the pillow. I'm going to start the insertion. Once I get into the nasal cavity, I'm going to have them tilt their head forward, chin to chest. I'm going to keep pushing the tube in until they begin to gag. At that point, you can pull the tube out a little bit, and then you can go back in. You can give them a little bit of water through a straw, have them swallow to ease the tube down, make it a little more comfortable. Keep easing the tube through until you get to the mark. Once you get to that mark, it should be in the stomach. I'm going to check the back of the oral cavity, make sure it's not recoiling in the back of the throat. Ask them to swallow, 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 keep swallowing. Okay, good. Once we've gotten to that point, I'm going to go ahead and check the placement of the tube. Ask the patient to speak. If they can speak, then it should be in the right place. I'm going to grab my 60 cc syringe. I'm going to hook it up to the end of the tube. I'm going to aspirate some stomach contents. Unhook it from the tube. Check my stomach contents on pH paper. Once I've done that, I can draw up a little bit of air. Hook it back up to the end of the tube. I'm going to grab my stethoscope. Place my stethoscope on the fundus of the stomach and inject the air into the tube. So I'm going to inject it. If it's in the right place, I should hear a swishing sound. Okay? And it is in the right place. You could do an x-ray. It is advised to do one just to double check and make sure it is. At this point, I can go ahead and secure my tube. I'm going to take the piece of tape with the split down the middle, tape it to the bridge of their nose, wrap the ends of the tape around the tube to secure it in place, make sure that it won't move. Okay, and I can take another piece of tape, place it across the bridge of the nose to make sure that it's really definitely not moving. I'm going to take my tube, wrap it around the patient's ear, secure it. I'm going to take my rubber band, put it around the end of the tube. And I can now safety pin the end of the tube to the patient's gown. Leave a little bit of extra to allow them to have some head movement. Okay, I'm going to remove all of this. Remove the towel. Make sure the patient knows that they have to keep the bed at a 30-degree angle at all times. I'm going to hook this tube, the end of the tube, up to suction. Okay, and once I've done that, I'm going to make sure the patient's comfortable, watch their response, make sure they're not having any issues with it. I'm going to document the type, the size, and the length of the tube, as well as the color and the consistency of the drainage. And I'm going to document the patient's response and everything that I taught the patient. For irrigation, you come into the patient's room, introduce yourself again, ask them if they've been uncomfortable or anything like that. You're going to unhook the end of the tube from the suction. Unhook the tube from the end of the suction. You're going to perform hand hygiene, and I would put on clean gloves. I'm going to take my 60 cc syringe. I'm going to hook it up to the end of the tube. I'm going to aspirate some of the stomach contents. Grab my stethoscope. I'm going to put my stethoscope back over the fundus of the stomach and push the stomach contents back through the tube. And I heard a swishing sound, so it's still in the right place. I'm then going to take the syringe off. I'm going to grab 30 mils of sterile water. Once I've done that, I can hook the syringe back up to the tube. I'm going to push the water through and pull the 30 mils back out. At that point, I can discard 30 mils of that, and then I'm going to rehook the tube back up to the suction. Thank you.